วัสดีค่ะ Hello everyone, I'm Dr. Gulakarnamon Patana from Bangkok, Thailand. I'm a plastic surgeon and hair restoration surgeon. I've been doing hair restoration surgery for more than 15 years. Today I'm going to speak about my example case of hair transplantation and eyebrow transplantation into female patients. We have example case today, a female of 30 years old. She had the hair transplantation done before, couple of years ago before she came to me, and she had the eyebrow transplantation done, but she is not so happy with the result, so she just come to see me and make a little fix in details. So starting with the pre-op consultation, we discuss with the patients about what she looks for, like the shape of the hairline, the density of the hairline, or any threads or any missing spot that she would like to fix. So we discussed together of what she likes. The lady complained that previous hair transplantation she get the very plucky look, and the very first rows of her hairline was from the multiple hair unit. She wants to remove the plucky hair out, and she wants to modify her hairline to a new shape with softer curve. And with the eyebrow transplantation, she wants to fix it about the directions and the angles and the density as well. At first, we discussed together of how to design a very good proportions. I always rely on these golden proportions or a Fibonacci ratios. You all know that these Fibonacci ratios we use for any kind of design, even the architects, even the artworks, and especially with the cosmetic procedures. I try to start from the middle axis, and then I try to get my instruments to help me get into a good proportion. We measure step by step from the mid of the eyebrow point and to the top of the forehead, and then we divide the forehead and her mid face and her lower face into 3 portions equally, and then I draw the hairline and let she look at it, and we discuss together with the patients if she likes it or she wants to modify a little bit of the eyebrows, and then we finally agree. And next step, going to the eyebrow. The eyebrow is a bit more complicated when you do the design. You need to measure the size of the eyebrow comparing to the width of the face and comparing to the size of the eyeball and the size of the nose until we get a final agreement with the shape she looks for, and then I draw the line. During my drawing of the hairline and the eyebrow, I use the instruments called laser hairline device. This can also help me do it quicker, but it is not the instruments all alone. It's supposed to be an artistic skill of the designer. So we discuss together with the patients, and then I draw the hairline, I draw the eyebrow using this device, and finally, after we agree, this is the final design of us. After we get a final design and a final drawing of the hairline and the eyebrow, then we step to the procedures. Before we doing the procedures, because I need the long hair for the eyebrow transplantation, so we have to prepare something. We need to tape the hair at the donor site, and I will do the multiple layer of the hair taping just like this. So during the surgery, it will be better and it will be a lot easier for me to go step by step. After we're done with the multiple taping of the hair, then we proceed to the operating theater. After checking of the vital signs, after checking of everything, then we will start administration of anesthetics. During the anesthetic administration, we are going to monitor the blood pressure, a pulse rate, and everything. This is for the safe sake of the patients. And after we're done with the anesthetic injection, I'll start to do a donor harvesting. When I do donor harvesting, we do the long hair FUE because I need the long shaft of the hair for the eyebrow transplantations. And you can see that with my technique, after we tape the hair and separate into multiple layers like this, the hair goes very tidy up. So we can do procedure without difficulties, and the graft will come out just like that, nice and easy, and a good quality grafts. After we're done over harvesting, we're going to put these grafts right into the recipient site instantly as soon as possible. So what we do is I do the pre-made incisions. With these techniques, we can control the hair directions and the angles and everything by my pre-made incisions, and then we are going to put the hair or the grafts into the pre-made incisions by using implanter pens. For the eyebrows, I do two techniques. The first one is implanters, but the second one is the manual forceps. I found that for eyebrow or the temples or the sideburns, we require a very flat angle. So the forceps and manual insertion may be better than the implanters all alone. So we modify the combination of two techniques to get the best result. And the procedure will be done under local anesthetic. Again, if you can inject a local anesthetic with a very good technique and a very good solutions. During the procedure, you can see that the bleeding is very less and the patient is free of pain because we have a right formula of local anesthetic injections. This is the meticulous and artistic work. So when we arrange the hair follicles, we must do it with the right angle and put it orderly, beautifully to get the very good result. And this is the final result immediate after surgery. After the procedure done, we will put on the dressing and sometimes we apply the topical antibiotics and allow the patients to go right back to the places or the hotel. And the next day we call them back for a professional watch. We do the cleaning for the patients in the first week, so the patient can come back for a follow-up. Especially in the first week, you can come to have watching, cleaning, and some light therapy in our clinic until we are sure that everything fine, and then you can proceed on your travel. So if you need some more information and you want to discuss about the procedure done in details, you can also contact us by email address down here, and you can also get into our website for more information. Thank you very much for your attention.